Good evening. My name's Elizabeth Wise. I'm the president and CEO at the University of Maryland Upper Chesapeake Health. And good evening, and I appreciate you coming out tonight for our public information meeting regarding our pediatric care transition. At this meeting this evening, I'll be talking about what is happening, why is it happening, the transition of care and the plan for that, how we will address the needs of the pediatric patient, the plan for our current pediatric staff, and the plan for the pediatric bed and the timeline for this. What is happening? Currently, we have one licensed bed at the University of Maryland Upper Chesapeake Health. It's on a unit called 1 East, and we will be closing the one licensed bed. I'll give you the timeline at the end, but we anticipate it to be on or around June 1st. There is no change in care. We will still continue to care for pediatric patients in our emergency room, and I'll talk about patients that may require a higher level of care, what we will do. And we just listed what is pediatric inpatient care, because the patients that require inpatient care will be those that will be transitioned. But children that will be transferred to a local hospital should they require a higher level of care. So why is this happening? We have had a decrease in the number of patients and typically average about 0.75 on average patient a day. And there are several months out of the year, particularly in the summertime, when we have 0 patients. So you may think about 0.75 is less than a person. And really what you do is we've taken the number of patients and divided it by the days in the year to come up with what our average is of 0.75. And the other thing that's happening, not only at Upper Chesapeake, but across the country and the communities, is that there is much more access to care for pediatric patients, whether it be pediatric urgent cares, pediatricians, family medicine providers. And so most of care is taking place in the outpatient, or what we call the ambulatory space. So how did we come to this decision? Over the past several years, we have adjusted staffing to the declining volume that we've seen. The one bed, particularly as we've had either one patient or 0 patients. But the challenge for the staff is really, how do you maintain your skill set? The more patients you take care of, the higher volume, the things that you say, you maintain a current skill set, or what we call in healthcare competency. And so it's really hard to do when you have a declining volume and a limited volume. So again, not all patients will require a pediatric hospital or a specialized children's hospital, but if they do, we are very fortunate to be part of the University of Maryland medical system, in which we have access to the University of Maryland Children's Hospital, which takes care of the most acute and critical patients. And we transition patients to the University of Maryland Children's Hospital, as is our current process right now. It says the University of Maryland Children's Hospital serves children throughout the state of Maryland, as well as has nationwide recognition as a leading children's hospital. And again, we're fortunate to have that access within our system, as well as at St. Joe's, it also has a pediatric unit as well. So as children come into our emergency room, we will continue to care for them by our emergency room providers, as well as our emergency room staff. If they require a higher level of care and the child is sicker or more acute, we will take them via ambulance or helicopter downtown to the campus that I mentioned, University of Maryland Children's Hospital, or another hospital that is accepting children. And if they do not require a higher level of care, we will care for them in the emergency room. And we do have some children that sometimes require surgical care, and we will care for them in our surgical recovery room. How will we address the needs of the pediatric population? It's listed there. The location will change from the unit, which we call 1 East, to care in the emergency room, and again, care by our emergency room providers as well as our emergency room nurses. Again, if a patient needs to be transferred to a higher level of care, we will do that. And we are currently working with our staff to make sure that this is a smooth transition related to any policies or skills that need to be done in order to continue to provide care to our pediatric population. In addition, we do have 24/7 pediatric hospitalist coverage. So if a ER provider determines that a pediatric hospital provider needs to be consulted, they are in-house and available 24/7. So the plan for the One East pediatric staff, the nurse manager who cares for a unit we call family birthplace in which we do deliveries, also is responsible for the pediatric unit. And so those discussions have taken place with each member of what we are employees, but we call team members, and they will be offered positions in the organization, either in family birthplace or in the emergency room, or we have other positions. If they choose a position outside of their current skill set, they will receive training and education in support of competencies to be able to care for whatever unit they have selected. The plan for the current unit is we will use it for overflow space for family birthplace. So there are times where we have a census that requires us to place patients on One East, and we will use that space for family birthplace and the care of moms and babies. And the timeline for this transition is expected to take place on or about June 1st. And I think that's the end of my presentation. So again, I want to just say thank you for coming and appreciate you taking the time to learn more. I will tell you that this information will be, the video will be available, as well as a transcript of the information that we've provided here this evening as well. Thank you. One of the questions or the comments is, what is the plan for parents who need transportation for Hartford County when their child is transitioned downtown for care? I don't know if I got the question right, but maybe their own personal transportation was the question related to something that's available. We currently do not provide transportation. And we routinely, at times have patients that need to be transferred downtown. We do not provide transportation to the parents or to another family member at this time. Okay, will there be a special room in the ED with pediatric supplies? We currently now take care of pediatric patients in the emergency room. So we have access to pediatric supplies. We have access to a pediatric code card if there's an emergency. So nothing will change in terms of our access and availability of pediatric supplies. And then what training or pediatric certifications will the ED staff have? Do you want to just mention, Michelle, about the PALS training?
The plan is to have the additional team members located in the ED receive the PALS training so they have the same competencies. We will also do a competency day totally dedicated to care of the pediatric patient, and then we will have dedicated huddles that will be run by our educator in the ER that will focus on the pediatric care of that population.
Do you want to just mention what PALS is?
Sure. So it's like the BLS, but for children. Right now we have a certain percentage that have that certification or designation, and our goal will be to have everyone eventually have that.
If there's no other questions, this concludes our information meeting. Thank you for your attendance.